Good morning, everyone. Welcome to our first day of Survivors Week 2021. I'm Lindy Milligan, the Survivorship Coordinator at Cancer Services, and on behalf of Cancer Services, Novant Health, Cancer Institute, and Wake Forest Baptist Comprehensive Cancer Center, we want to welcome you all here today. We have a very fun and informative week scheduled for you, and we hope you can join us every day. Before we get started, I did want to ask all the survivors out there to do something for me. If you have picked up your goodie bag at Cancer Services, which is a beautiful backpack, looks like this. Inside that, you will find a certificate that says I celebrate. And I want you to fill that out. Directions are on the back. And then you can email that to me at lindy@cancerservicesonline.org. And we will have these as part of our slideshow on Saturday for our party. If you have not picked up your backpack yet and you're still interested in receiving one, you can call our office first to make sure that we still have some, and then they will set it outside for you to pick up. And our number is 336-760-9983. If you have not picked up a pack and you still want to participate with the sign, you can download a copy of the sign from our website, and that's at cancerservicesonline.org/Survivors Week. Now I want to introduce you to our panel today. We are very excited to bring you the presentation today on stress, sleep, and anxiety, better known as lions, tigers, and bears. Oh my, so here are our speakers for today. We have with us first, Jonathan McGuirt. Jonathan is a PA at Novant Health Cancer Institute at Forsyth. His primary role is within neuro and thoracic oncology, but he enjoys helping out in other clinics whenever it's needed. He graduated from Wake Forest with a PA degree in 2018. Prior to that, he lived and worked in Charleston, South Carolina. He is currently residing in Winston-Salem with his wife and 4 furry children. He enjoys coffee, live music, and making a ruckus playing the drums. I'd love to hear that someday, Jonathan. Next, let me introduce you to Cameron Sweeney. Cameron is a 2018 graduate of the Wake Forest PA program and is a 2021 graduate of the University of Michigan Integrative Oncology Scholars Program. She has practiced integrative oncology since 2020. Cam is an avid cyclist whose longest ride is a century, better known as 100 miles. She is currently training for and fundraising for a 60-mile ride in the 2021 Victory Ride for the Cure, a fundraiser for the V Foundation for Cancer Research in Raleigh. And last and certainly not least, we have Katie Miller. Katie has been with Novant Oncology for 7 years, starting out in the outpatient specialty pharmacy, and now currently a clinic embedded pharmacist in the breast clinic. She is also involved in oncology symptom management clinic that is conducted on Wednesdays to support symptoms ranging from depression, anxiety, smoking cessation, etc. Outside of her work, she and her husband, Stephen, who is also a pharmacist, have 2 children, Luke, who's 5, and Kennedy, who's 3. If you have any questions during the presentation, please type them in the chat box or the Q&A, and we will try to answer them when the panel completes their presentation. So panel, thank you for being here, and take it away.
Thanks so much, Lindy. Good morning, everybody. I'm John McGuirt, as Lindy said. Let me be the first of many people this week to welcome you to Survivor Week. And I just wanted to say from a very heartfelt place that you guys are the reason that we all do what we do every day. Whether you are a 1 year, 6 month, or 10-year cancer survivor, it's walking with you along your cancer journey that makes our job worthwhile. And that is why we show up each and every day. So again, congratulations, welcome. And I hope that this week is good for each and every one of you. And we're hopefully going to start it off right by providing some information on some common issues that affect cancer survivors. I'm going to switch and share my screen here. And we're going to hope that technology works. All right. Everyone should be seeing our PowerPoint presentation. And then I'm going to switch into slide share mode. Which screen do you guys see?
We see the one with the slide, but also with the next slide.
No, okay, okay. So not the proper.
Correct.
All right. How about now?
Perfect.
Perfect. All right, guys. These technology things are not my strong suit, but I appreciate everybody for bearing with me. All right. So first off, let's look at a roadmap of what we're going to be talking about today. As Lindy said, we're going to hit 3 of the most common topics that arise in the survivorship period. We're going to talk about insomnia. We're going to talk about anxiety and stress. And then we're going to talk about some integrated ways to address these topics, as well as some more traditional pharmacotherapeutic options. And we're going to walk through all this together. And hopefully we're going to have a little fun along the way. I'm going to start us off by talking a little bit about sleep. Sleep, how much should we get? Well, according to the National Sleep Foundation, for those of us who are below 60 years, we can get by with 7 hours of sleep per night. As we get older, we need a little bit more, 7 to 9, 7 to 8 hours. And I don't know about you guys, but it has been a long time since I myself have gotten 7 hours of sleep consistently. But truthfully, it's a very, very important thing. Sleep is vital to all human functioning. It is particularly important among cancer survivors because look at the things that it can do. Reduces stress. It increases focus, reduces inflammation, and improves memory. All very salient things in the cancer survivorship period. In addition to the host of other things, it really is our body's way to renew itself and reset itself from a cellular level. Without sleep, unfortunately, bad things can happen. This is why we harp on the fact that sleep is very important. Sleep has been linked to not only the onset of type 2 diabetes, but also having more difficulty with controlling those blood sugars. Folks who have a little bit too much weight oftentimes have issues with sleep. Sleep is one of our body's way of setting our basal metabolism, or our body's ability to burn fat just when we're sitting still. And when our sleep cycle is disturbed, so is that metabolic rate that tells our body to use the energy that we give it through food. Sleep has been linked to heart disease as well as depression. All, again, things that are very common amongst cancer survivors, just reiterating the need for making sure that we're all getting enough sleep. This is something that I talk to my patients about on a daily basis. And I frequently hear the question, well, John, why can't I sleep? Sometimes it's due to many different causes, but there are some underlying sleep disorders or actual medical problems that prevent folks from getting sufficient restful sleep. These include things like insomnia, hypersomnia. Hypersomnia is, of course, being very sleepy during the day. That's like when folks are reading a book, falling asleep, watching television, falling asleep, or sometimes even having a conversation, falling asleep. Insomnia is actually the difficulty of falling asleep or staying asleep. And it has to happen for at least 3 times per week and has to last for at least a month or more. So at least 4 weeks. We all go through periods of time where, there are different things happening or different things that we're doing during the day that are interrupting our sleep. And that's normal. But what becomes abnormal is when that pattern persists over weeks to even months. And that's when we need to get involved as providers. Obstructive sleep apnea is a very, very common issue now. Of course, sleep apnea is not only snoring, but also waking up, gasping for breath, or stopping breathing while you sleep. Sometimes this is very obvious that a person has sleep apnea. Sometimes this is not very obvious, even to folks around you. The old adage is that when you correct someone's sleep apnea, the patient doesn't thank you, but their spouse does, right? Because the spouse has been kept awake all night by their snoring. But the reality is that some folks do have mild sleep apnea and they're not keeping their significant other awake at night. Restless leg syndrome is another condition. This is that uncomfortable, unstoppable, creepy, crawly feeling in your legs that you wish you could go to sleep and you're really tired, but your legs just won't let you go to sleep. All these things are medical conditions. All these things have different treatments. They have different causes. And the only way to help someone get back into restorative sleep is to address these issues. Again, this is a particular problem among cancer survivors, and we have studied this at length. One of the largest studies and one of the longest running studies went up to 9 years after diagnosis and found that nearly 1/5 or 20% of cancer survivors reported poor sleep quality. When these researchers dug a little bit deeper, they found that the problems with sleep were typically related to one of 4 things. Fear of the cancer coming back can keep people up at night. Financial concerns as a result of cancer treatment or just as a result of things that have happened due to cancer. Physical problems actually had the strongest link. So folks that have ongoing physical issues, be that pain or what have you, had the most problems sleeping. And then emotional problems. And we will see throughout the course of today's lecture that anxiety, sleep, depression, stress, all these things are very closely interrelated. And when there's a problem with one, there can very frequently be a problem with another. Sleep medication was reported to be used among about a little less than a third of long-term cancer survivors. I typically have 2 kinds of patients. I have patients that very much want a sleeping medication. And then I have patients that say, I can't sleep, but I don't want a sleeping pill because I don't want to be groggy the next day. Or I don't like taking medicine every day. And I took enough medicine during my cancer treatment. The last thing I want to do is take another pill. And so, I think realizing that it's a very common thing to have to use a medication, be it a prescription medication or be it an herbal supplement or any other type of medication that you have to use for sleep, is a very normal thing and a very common thing in the survivorship period. Let's move on just to our introduction to anxiety and stress. Now, there's some confusing terms in here. So stress is the actual state of mental or emotional strain or tension resulting from an adverse or very demanding circumstances. Gosh, that sounds like cancer, right? That sounds like cancer would create a lot of stress or leads to feelings of anxiety, right? I'm a little bit on edge. I'm a little bit keyed up. That's a normal response to stress. Our bodies are ingrained with that response, right? And this goes all the way back to when we were getting chased by saber-toothed tigers. That's a state of emotional or mental strain, and that provoked a physical response in our body. That's a normal thing. But what's not normal is when the worry is so severe that it upsets our daily life, right? That's not something that needs to happen. This is frequently, but not always, accompanied by physical symptoms. This is when folks say, gosh, my heart just starts racing out of nowhere, or my tummy gets really upset. I get nauseous, or I have diarrhea, or things like that. So this is the sign that maybe something, this is not normal, anxious or worried feelings. I feel like sometimes patients tell me, I'm kind of anxious, I'm kind of nervous, but of course I am because I have cancer, right? Or I'm getting over a cancer diagnosis. And I don't stop at that, right? I like to dig a little bit deeper with my patients and say, well, how is that affecting you? How is that affecting you? And if they say, well, it comes and goes and I get along just fine. I'm like, okay, that seems like a normal response. But when they tell me that they leave the cancer center and they cry in their car, or that they dread driving down Silas Creek to come to see me, or that they're staying up at night because they're worried about their cancer coming back, that's something that I need to address. That's something that we as providers need to address. It's not the patient's fault. It's not our fault. It's something that is a natural response to what has happened and what is going on. And thankfully, there are very good treatments. So looking in particular at anxiety and stress in cancer patients, we know that anxiety affects cancer survivors and actually their spouses as well, more than their age-matched counterparts. So I'm 37. For 37-year-olds who had a cancer in the past, they're more likely to have an anxiety disorder than I am, or my wife. The most common source of anxiety among cancer patients, hands down. I've been through this. I think this is behind me, or I think I'm getting through it okay, but is it going to come back? Is this going to get worse? That's a normal reaction to having a diagnosis of cancer, or having had a diagnosis of cancer in the past. I think another under-recognized cause of stress and anxiety in a certain population of cancer patients is that transition period from when you're going through active treatment and you're seeing us weekly, you're seeing radiation oncology every day, or you're seeing us once every 2 weeks. You're in this pattern and you're used to us checking on you. You're used to having a visit and we're asking about all your symptoms and we're checking off these lists and we're making adjustments to medications. And then all of a sudden we say, gosh, that was your last radiation, or gosh, that was your last chemo. That causes anxiety in a lot of patients because they're like, my gosh, what do I do now? Right? It's important for us. It's important to us that your recovery and your definition of recovery is sometimes different than mine. And I have to bridge that gap. And you have to let us know that okay, you say that I'm finished with treatment, but I'm not okay yet. I still need some help. And that's okay. That's all right. A lot of times during this period, I'll tell folks, to stay busy and to try to find something, an outlet that they like to do. But I also warn people and caution people at any point during their cancer journey that you don't ever have to feel like you have to do everything at once. I feel like some people say, even though I have this diagnosis or I've had this issue in the past, I have to be the same person for those around me. I have to stay strong for those around me. And I respect that. And that's one of the main reasons I love working with cancer patients. They're the best patients in the world. But the fact of the matter is that this is your time, and this is your time to help yourself. And if you don't do that, then, that's when we really see problems happen. Thankfully, the last point I think is a very salient point. I looked as late as this weekend, and I can't find a study that says that worrying about cancer returning makes your cancer return, right? That's a good thing. But I've also yet to find a study that's saying worrying about a cancer keeps cancer away. So it can be debilitating for a person that's trying to live their best life in survivorship. And thank goodness there is help. And we're going to talk about those ways today. Before I leave, this is my last slide. I just wanted to put a few things out there about when it's time. If you're wondering about, gosh, is this normal? Should I ask my doctor or my PA or my nurse practitioner? Should I ask them about if what I'm going through is normal? Here are some signs, right? If these have been going on, and I'm not going to bore you by reading them, I'll just point out a few. But if anything, I will say that's going on for 2-3 weeks that just you can't squash in your brain, that just won't go away, it's probably something that you need to mention to your treatment team or to someone you really trust around you. And then of course, the last thing that we want is for anybody to entertain thoughts of doing something that they wouldn't want to do in terms of hurting themselves. So that's a no contest, right? Those feelings have to be reported to somebody, and there are folks out there that are willing to listen. Okay. Again, thank you all so much for joining our presentation this morning. I hope that you enjoy what Cam and Katie have to say. They're very good presenters, and they have a wealth of knowledge that they're excited to share for you. If you need anything from us, we are here for you. So please feel free to reach out. All right, I'm going to turn it over to Cam Sweeney.
Good morning, everyone. Thank you for tuning in today. Go back, John. There we go. Thank you for tuning in today. Nice to see you virtually, I suppose. I've worked in our conventional cancer clinic since 2016 with a focus on breast cancer, and I've worked in our integrative oncology clinic for the past year. I'd like to start today by telling you a little bit about integrative oncology. And I hate reading directly from slides, but I'm going to today just because this is a really good definition, and a lot of people don't actually know what integrative medicine or integrative oncology is. But according to the Society for Integrative Oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle modifications from different traditions alongside conventional cancer treatments. This is an important distinction between complementary medicine recommendations, which are in addition to your conventional cancer treatment, which is what we practice in our integrative oncology clinic, versus alternative medicine, which is instead of your conventional cancer treatment. The definition continues: integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. Next slide. So what that means is that integrative oncology takes a holistic approach that incorporates mind, body, spirit, and community with an emphasis on healing. We may make recommendations for nutrition counseling, exercise or physical activity, vitamins, herbs or supplements, acupuncture or other components of traditional Chinese medicine, yoga, oncology certified massage therapy, meditation, and mindfulness. Next slide. So now that you know what integrative medicine is, let's talk about an integrative approach to sleep. We'll start by talking about the sleep environment, or what we call sleep hygiene. One of the primary recommendations that we make is limiting screen time or using blue blockers in the hours before bed. These might be physical filters that sit on top of your computer monitor, or settings on your cell phone or iPad or tablet that turn the screen kind of orange, or even blue blocking eyeglasses that you can wear at night. Limiting caffeine intake. For example, I typically won't drink caffeine after about 3 o'clock in the afternoon, unlike my friend John, who drinks coffee 24 hours a day. Going into the bedroom only when ready to sleep, and using the bedroom only for sleep and sex. If you're not doing either one of those things successfully, then get up out of bed and go into another room until you're ready to try again. Avoiding naps during the day and getting regular exercise can help you feel tired enough to need sleep. It's important not to do vigorous activity or vigorous exercise within about 3 hours of bedtime, though, because it might wake you up. You may want to try to develop a calming sleep ritual about 30 to 60 minutes before bedtime, taking a restful bath, soaking your feet in warm water for 10 minutes, keeping the bedroom a comfortably cool temperature. And finally, resetting the pineal gland in your brain by going outdoors daily between the hours of 8 a.m. and 4 p.m. and letting sunlight actually hit your eyeballs. Next slide. Cognitive behavioral therapy, or CBTI, is considered the gold standard for treating insomnia, and it can be quite effective. According to the Sleep Foundation, up to 70 to 80% of patients with primary insomnia see improvements in the time it takes to fall asleep, the time spent asleep, and fewer episodes of wakefulness during sleep. CBTI is a multi-pronged approach that incorporates cognitive interventions such as identifying and altering inaccurate or dysfunctional thoughts about sleep, behavioral interventions such as relaxation training and stimulus control, and psychoeducational interventions such as providing information about the interconnection between thoughts, feelings, behaviors, and sleep. It does require meeting with a trained provider, and it can take about 6 to 8 sessions to be most effective. We can always refer you to a mental health professional who specializes in CBT. Next slide. So let's talk a little bit about herbs and supplements. Many people think that because something is natural, it's safe and effective. This may or may not be true. It's important to know that nutritional supplements are not regulated by the FDA, which means that the bottle may or may not contain what the label says it does. And the product may even have contaminants. Some herbal supplements may contain heavy metals or other dangerous substances. There are a lot of supplements for sale in the corner drugstore or online that simply have no evidence to support their use. Some can interact with your prescription medications, chemotherapy, or radiation therapy, and some can actually be downright harmful. There is scientific evidence to support the use of some supplements in some cases, although more research would always be helpful. When it comes to any supplement, it's important to ask questions, educate yourself, and think critically. Don't assume that it's safe. So with that warning in mind, let's talk about supplements for sleep. Lots of people have heard of melatonin, and it can be effective for resetting the sleep cycle. Melatonin is a naturally occurring hormone produced by the pineal gland in the brain in response to darkness. So it's at its highest level between midnight and 8 a.m., and it helps promote sleepiness. Melatonin helps regulate the circadian rhythm or the sleep-wake cycle. Melatonin is actually produced when the eyes do not receive light. Blue light waves, such as those from fluorescent light and devices like TVs, tablets, and cell phones, mimic sunlight. That's why screen time at night can interfere with sleep patterns, because it tells the brain it's time to be awake and suppresses melatonin production. Melatonin production also naturally decreases with age, which may be one reason why older people may have a hard time sleeping. However, many people take too high a dose of melatonin. More is not always better. Often the dose you find at the drugstore is 10 to 20 milligrams, and that's actually too high. That might be better for someone who has jet lag from flying across the country, but it may make you wake up in the middle of the night. In our case, we think a lower dose is better, around 0.3 to 1 milligrams, maybe up to about 3 milligrams, taken about 2 hours after the evening meal and about 1 to 2 hours before bedtime for occasional use. The lower dose can actually be hard to find at the drugstore, but you can usually find it online or at Amazon. It's important to know that melatonin may have an interaction with anticoagulants such as warfarin. So if you take a blood thinner, talk to your doctor before trying melatonin, since it might increase your risk of bleeding. Melatonin is also an antioxidant, which can decrease the effectiveness of radiation therapy. So you should not take melatonin for at least 1 week before, during, and at least 1 week after completion of radiation therapy. Next slide. Other supplements that can help with sleep include magnesium citrate, 300 to 400 milligrams at bedtime, can help with sleep and also promotes healthy bones, can also help with constipation. However, if you experience loose bowel movements with starting magnesium, you can switch to magnesium glycinate, which is another formulation, or just stop taking it. There's also a supplement called Best Rest formula that includes several herbs such as chamomile, valerian root, lemon balm, passion flower, and that low dose of melatonin, 1 milligram that we talked about. Best Rest does cost about $30 for a month's supply. You can purchase it online, I think at Amazon and other sites online, or you can call our integrative medicine clinic. We do sell it for you. We do think it's important not to use any sleep aid every night. Humans can easily become habituated to something and feel anxious that they may not be able to sleep without it. So try to use any sleep product no more than every other night for about 2 to 3 weeks before taking a break from it. Another product that can help some people, I know I drink this on a regular basis, is Sleepy Time tea, just available at the drugstore. It's a relaxing blend of chamomile, spearmint, and other herbs. They also have another product called Sleepy Time Extra, which includes valerian root, which is a natural sleep aid. So read the box or the label. Next slide. Often, and John was talking about this, we have a hard time falling asleep or may wake up in the middle of the night and be unable to go back to sleep because our mind is working overtime. I find sometimes it helps to write down whatever those distracting thoughts are. You may want to keep a tablet next to the bedside, or you may want to just get up and write it down. But your brain may be trying so hard to remember something that it can't relax. So if you write it down, your brain can suddenly feel relieved enough that maybe you can rest. Personally, my favorite way to quiet the mind for sleep is with meditation, prayer, and belly breathing. I often say the Lord's Prayer to myself, which is reassuring and calming to me. Focusing on the words of the prayer or the poem or rhythmically counting your breaths can focus your mind enough that you actually distract yourself from all those other thoughts that are flying around in your brain. There are lots of good meditation apps for your phone that you can try. Headspace and Calm are 2 of them, but there are many, many others. Some of them have costs associated with them. Some are free. You kind of have to experiment to find one that works well for you. Some of the apps use guided meditations where they talk you through relaxing your muscles in a progressive way from your head to your toes, or they help you use your imagination to feel relaxed and visualize feeling tired and sleeping well. Deep breathing can help calm you by slowing your heart rate and lowering your blood pressure. A biochemistry researcher at Stanford University demonstrated a connection in mice between the brain cells that control breathing and the nerve cells that signal the arousal center. So you can literally calm your brain by calming your breathing. So let's try something called the 4-7-8 relaxing breath exercise. Most of us in the United States use only a small part of our lungs, maybe because we wear tight pants and we can't really expand our bellies. I don't know. When we take a deep breath, our shoulders rise. We go, but our lungs aren't up here. Our lungs are here. Think about where they are. Your lungs fill your entire rib cage. So I want you to put one hand on your chest and one hand on your belly. And I want you to feel your belly expand when you take a deep breath. Push your belly out. When you exhale, you should feel your belly button sink down and in towards your spine. Breathe in through your nose for a count of 4. Hold it for 7. And then out through your mouth for a count of 8. If there's no one else in your bedroom, you can exhale a little loudly like Darth Vader, but you don't have to do that if you don't want to disturb your partner. So when you have that really long exhale, it's going to encourage you to take a really good inhale. So let's do it again. In through your nose for 1, 2, 3, 4. Hold it for 7. 2, 3, 4, 5, 6, 7. Exhale, Darth Vader. 2, 3, 4, 5, 6, 7, 8. Inhale for 4, 2, 3, 4. Hold it for 7, 2, 3, 4, 5, 6, 7. Exhale, Darth Vader, 2, 3, 4, 5, 6, 7, 8. And doing that counting and really focusing on getting your belly moving can be really, really relaxing. So give it a try. Next slide. So that's going to lead us into stress relief and anxiety. Meditation is considered grade A for reducing anxiety in breast cancer patients. It's not that it doesn't work for patients with other types of cancer, but the reality is most of the research has been done with breast cancer patients. Overall, mindful meditation programs showed moderate evidence of improved anxiety at 8 weeks, 3 months, and 6 months. The evidence was not quite as strong for improving stress or distress and mental health quality of life, but still there was some evidence to support it. There's a particular form of meditation called Mindfulness-Based Stress Reduction, or MBSR. It's an 8-week group program or course that's taught by a certified trainer to assist with stress, anxiety, depression, and pain. MBSR was developed in the 1970s by Professor John Kabat-Zinn at the University of Massachusetts Medical Center. Mindfulness, or moment-to-moment non-judgmental awareness, means focusing on the present, and that can help break the cycle of ruminating over the past or worrying about the future. MBSR programs include instruction in 3 formal techniques: mindfulness meditation, body scanning, and simple yoga postures. Require a significant time commitment, 45 minutes a day, 6 days a week, and usually have a cost associated with them. However, there's a free alternative online called the PalouseMindfulness.com. Meditation therapies are generally considered low risk, but people with serious mental health issues or diagnoses should proceed with caution. These people may benefit from individual counseling or psychiatric intervention prior to or at the same time as trying a meditation or mind-body program. Next slide. Novant Health has partnered with instructor Lindsay Bridges from the Charlotte Center for Mindfulness to offer a free online mindfulness class for beginners held weekly for 5 weeks, starting this Thursday, June the 3rd, and ending July 1st. The classes are 1.5 hours and are held 6:30 to 8 p.m. on Thursdays. If you'd like to reserve your spot for the online program with login information, you can call that number. But if that time doesn't work for you, the Charlotte Center for Mindfulness also offers YouTube live stream guided meditation practice. Next slide. There are other integrative therapies for anxiety and stress reduction, which have grade B evidence. So we think helpful, but not quite as much actual scientific study to support it. Passive music therapy, which means listening to music, is different from active music therapy, which is singing, playing an instrument, or composing music. And passive music therapy has been shown to reduce anxiety during radiation therapy, chemotherapy sessions, and post-surgery. There are stress management programs that utilize techniques called guided imagery. I often recommend a website called healthjourneys.com. They have a large library targeted to specific problems, including optimizing radiation therapy or chemotherapy, fatigue and tiredness from cancer treatment, a guided meditation to support a healthy immune system, and beyond cancer or other healing meditations, women's health, hot flashes, insomnia, anxiety, depression, and more. Each of these meditations at Health Journeys costs about $15 to download. However, the health plan, Kaiser Permanente, also offers a few guided meditations that can be downloaded for free. These topics include coping with cancer, dealing with chemotherapy and radiation therapy, fibromyalgia and chronic fatigue, relaxation and wellness, sleep, weight loss, coping with grief, panic attacks and anxiety, and more. Next slide. Yoga also has grade B evidence for helping with stress and anxiety. And we have a fabulous yogini, Angela Gallagher, here at our Integrative Medicine Clinic. She has 34 years of experience as a yoga teacher. She's certified in Sivananda Yoga and the Agastya postural alignment, which is very helpful for musculoskeletal pain. Angela will be conducting a chair yoga session, I think, as part of Survivors Week. I think it's tomorrow. Unfortunately, yoga is not covered by insurance, and you can call our office to schedule an appointment. She does sessions by Zoom. And finally, there are some other integrative therapies that can help with stress and anxiety. Overall, the evidence is not quite as firm, but there is some suggestion that it can help. And that includes acupuncture. We have a licensed acupuncturist here, and also oncology certified massage. Neither of these therapies is covered by insurance, unfortunately, but you can call to schedule. Did I see a hand? I'm not sure if I saw a hand. We're here at our Integrative Medicine Clinic. You can be referred to us by your oncologist, or you can refer yourself if you'd like more information. Consultation with one of our doctors or a PA like me would be covered by insurance, but as I discussed, some of those treatment modalities like acupuncture, yoga, and massage are not covered by insurance. Thanks again for listening. I just wanted to let you know, cancer is important to me personally. My mother has had breast cancer twice. My father has had prostate cancer, and right now is under hospice care for metastatic lung cancer. And so I find that working with cancer patients every day is the most rewarding work I could imagine. So thanks for listening.
Hello, good morning. My name is Katie. Thank you, Cam, for helping to transition now into my section. So I'm really going to build a lot on the foundation that Cam and Jonathan both have done. Please remember that the information that I'm going to go over today is really just a brief touch on options of prescribed therapies that are out there. One size does not fit all for all patients. And so when looking at these options that we're going to discuss, really, this is when the good team approach happens with the pharmacist, your provider, and yourself to figure out which one of these medications best suits you. Next slide. So sleep. Again, reiterating the fact that cognitive behavioral therapy, natural integrative medicine are all vital pieces in managing sleep long-term for all patients. So when non-pharmacological therapies are not quite enough is when we can look at more prescribed. I like my little bear down there because it doesn't matter what is keeping you awake. Our goal to help support you is to identify those and to help correct them so that you have a good night quality of sleep. So you may be excited in the morning to wake up eating breakfast, and that might be the reason you can't sleep, although usually not the main reason. Next slide. So to understand insomnia, it's good to understand what types of insomnia really is out there. And again, it reiterates in the beginning that pharmacotherapy should not be the sole treatment for insomnia, that cognitive behavioral therapy is typically recommended as first line for chronic insomnia. And then you have to decide where the complaint of the insomnia is. Is it difficulty falling asleep at the desired time? Does it take you longer than 30 minutes? Does it take you an hour to actually fall asleep? And then once you are asleep, is that sleep quality and quantity, is it good enough? Or are you waking up in the middle of the night? So the next side of this chart talks about sleep maintenance or mixed insomnia. So this is when we're looking at it being more difficult sleeping through the night. So basically greater than 30 minutes, you're awake in the middle of the night, or you're waking up too early. So the onset of sleep may also take longer than desired. But this is not typically the only complaint. And I do see one of the questions on the chat is actually asking that specific question. What are the recommendations for patients who may not necessarily have difficulty falling asleep, but have trouble with early awakening or falling asleep, really late and then awakening really early. So we'll address some of those options that are out there as we move forward. Next slide. So treatment options. I'm typically, big on exhausting all our options that we can without having to go to prescribed therapies. I know that's funny. I'm a pharmacist. You would think I would want you to be on medications. But again, remember, this isn't a one size fit all. There are over-the-counter medications that are marketed to help with sleep. And as Cam addressed in her presentation, these are not medications that you should be taking every single night. If you take them every single night, then unfortunately, it does have a tolerance effect on you or could make your symptoms worse that you're experiencing. So doxylamine is one that, you hear a lot about. The brand name of that typically marketed as Unisom. So doxylamine is an option. Benadryl or diphenhydramine is also an option. I do want to caution you, Benadryl is not typically a benign drug. It can cause restless leg syndrome. It could cause you to feel jittery. It could make you feel kind of out of your body. So Benadryl is not always the best option either. And then, of course, melatonin, which Cam addressed earlier. My little starburst down there says, be brand cautious. We're in the era of companies, unfortunately, marketing different products. It is a money world, unfortunately. So be very careful with what you buy. Just because it says Unisom or just because it says Sleep Ease does not mean it's better than just basic Benadryl or just basic doxylamine. Really read the back of your box and look at the ingredients. You really don't want to pay more for a name brand option when you can get a generic or a store brand option for cheaper and have the exact same outcome that you would have with the name brand. Next slide. So this next slide really is diving into the different types of prescribed therapies that are out there. And I broke them up in class. I don't expect you to understand what these different classes target, but oftentimes we try to stay away from controlled type substances because the reason why medications are controlled, and when I say controlled, it usually carries like a class 2 or class 3 or class 4, is because we know that they do have a tolerance or a dependence, or lack of a better term, just an addictive characteristic property. So if we put you on these medications and we decide in the future that we need to take you off of it, it is not usually a seamless process. It does take a lot of time, a lot of tapering. You need to avoid withdrawal type syndromes. So please keep that in mind. If you bring it to your provider that you want to try something like temazepam, which is a benzodiazepine, they may try you on something different before we have to exhaust that option. So non-benzodiazepines, some terms you probably are more familiar with are Lunesta or Sonata or even Ambien. You've got some other agents down there that, work on different types of receptors by antagonizing them or, blocking them. And those are listed there. Serum, and then on the right side, you've got some miscellaneous anticonvulsants that are typically off-labeled indications, but they have been studied in clinical trials to work, but they just don't have the FDA approval for sleep. Okay. And that's gabapentin and trazodone. Next slide. So now I'm going to transition to anxiety. I typically look at anxiety and stress very similar on the same level in regards to how we prescribe therapies. So as you can see to the right, I have a little bit of a sense of humor. Most of you guys that are on, I've been with you in the beginning of your treatment all the way to the end. So none of these memes should surprise you. But here it says, when someone asks you how your night went, well, I didn't get enough sleep, but I had a few hours to put in some anxiety. So I always think that's pretty funny because it can go hand in hand. Next slide. Types of anxiety. There are so many types of anxiety, and how we treat each of these anxieties are completely different. So you can see there's social anxiety. And now that we've all been COVID quarantined away from society, a lot of folks who have overcome social anxiety will go back into a similar setting, unfortunately, when we are able to intermingle again. But there's post-traumatic stress disorder, there's, fear of different things, there's worry, there's obsessive compulsive disorder, there's different types of phobia, and just everyday anxiety and stress. Remember, stress and anxiety, specifically stress, there's good stress and there's bad stress. There's stress, good stress could be your 5-year-old's getting ready to start kindergarten. That's a good stress. You want them to do well, but you worry about them. Or you're planning a wedding, or you're getting ready to have a baby, or some big event is coming up. They're good stress, but it's still stress, and it still does a toll on your body. So I'm actually going to focus on 2 specific areas of anxiety today. We're going to look at generalized anxiety disorder and anxiety separately. And the reason for that is because we can build on that with the type of therapies. Next slide. You have to hit it again because it's there you go. Generalized anxiety disorder. So this is the first one that I want to look at. Next slide. Generalized anxiety disorders, there's several classes that we use. A lot of these same medications that you will see, we also are using for depression and other types of, symptoms that you may experience during chemotherapy, or even worried about cancer coming back. So your SSRIs, which are your selective serotonin reuptake inhibitors, a lot of these you'll be familiar with: Lexapro, Zoloft, Paxil, Prozac. These really can be used interchangeable. Some patients could be on Lexapro for a certain amount of time, realize it's not working for them, and they may switch to a different drug within the same class. That is completely normal. Again, remember, one drug does not fit all. There are side effects that people aren't able to tolerate, and switching from one drug to another may eliminate those. There are your serotonin norepinephrine reuptake inhibitors, or your SNRIs. Those are things like Cymbalta or Effexor. Usually we see Cymbalta also used for like neuropathic type pain. We see Effexors to manage hot flashes in patients. So remember, they're not only for generalized anxiety disorders, we can see them in other areas. And then my miscellaneous down there, Buspar, I typically recommend using a lot in our oncology symptom management clinic. It is very similar to something like Xanax or alprazolam. It is an anti-anxiety medication that doesn't have the tolerance properties or the class associated with it. So a scheduled, drug 3, drug class 4. But those can also help with like your situational quick anxiety. You have Lyrica down there that can be used also for neuropathic type pain. You also have Remeron, which can help with sleep. And you also have your, antipsychotics, which I don't want that to carry such a negative connotation. So quetiapine or Seroquel is an antipsychotic, but it also helps with generalized anxiety disorder. And for some patients who underwent systemic or conventional chemotherapy, you see that we do use antipsychotics to also manage nausea. And then the last one down there is Atarax or hydroxyzine. That can be used for, itching or other type symptoms, but also can help with anxiety. Next slide. It's going to be another firecracker. There we go. Anxiety disorder. So the reason I want to talk about this differently, generalized anxiety disorder usually needs a long-term baseline maintenance medication. So those SSRIs like Lexapro and citalopram. So anxiety can also be treated the same way with a maintenance medication. However, sometimes we do have to slip in those benzodiazepines for those, high anxious type moments. I usually can relate that to my radiation patients who have to be put in a machine or an MRI. They have that claustrophobia, so another type of anxiety. And they may need an Ativan or lorazepam to help get them through that particular moment. So some benzodiazepines like Xanax, Klonopin, Ativan, and Valium. Next slide. So what I want you to remember is this really is an integrative team approach. We're all in this together. If you sat down with me in chemo teaching, or I've seen you in clinic, I usually tell you our goal is to really have no side effects with any therapy. And the same holds true with the regimens that we recommend for sleep, for anxiety, and for stress. These side effects are different for everyone. I usually tell patients, if you pull the Tylenol package insert that you get in your box, there are so many side effects that are listed there. And how often do we really have those side effects? So if you don't tell us that you're having a side effect with this medication, we don't know. So don't be afraid to share that with us. Share that with your provider, share that with your pharmacist. And most of the time, doing things like switching therapies or changing the dose may be all that you need. But the reason I want to let you know this is a team approach, because Cam alluded to this early, these aren't benign. There are drug interactions. You could be on something like a Synthroid medication or warfarin, and giving you something like this could cause it not to work. My best example, because obviously I work in the breast clinic, some patients are still on tamoxifen because of their estrogen receptor positive status. We need to know that you're on that medication still, because if we give you a certain antidepressant, it may cause the tamoxifen not to work as well. So you're not getting that benefit from the drug. And then, of course, if you decide you want to stop taking the medication, we never encourage you to stop any of those medications cold turkey or just stopping them all of a sudden, because you could have withdrawal symptoms, things like sweating, nausea, headaches, fatigue, or feeling wired up, and not really feeling yourself. And oftentimes patients say, I felt worse than I did before I even started taking a medication. So be open with us and let us know what your plans, your desires are, because adherence is super important for these medications to work. And also we want to avoid any unnecessary side effects. Next slide. And there are many resources that are out there. Obviously, you are already connected with cancer services. So you're fully aware of the support groups that are out there. Reaching out for yoga classes or information to get you set up with different seminars, they're there for you. I have to throw in a little plug for Oncology Symptom Management Clinic, because I see patients around smoke and cessation. I see patients who have anxiety or depression or can't sleep at night or just want a better quality of life. And, that's usually coupled with a provider as well as myself. And then the next point I wanted to point out kind of goes hand in hand with Cam's presentation, consumer labs. So a lot of our herbal supplements that are out there, 10 years ago, I'm going to date myself a little bit, when I was in pharmacy school, there was not much data or support that was out there for over-the-counter herbal supplements and things like that, because we didn't have the data. We didn't have the FDA approval. But now looking back today, there's so much out there, so much research. So I encourage you to do your research, that even though these over-the-counter supplements aren't quote unquote FDA approved, does not mean that it's not beneficial for you. So this consumer lab is an independent company that really goes in and looks at different herbal supplements and tests what's really in it. The FDA, to get FDA approval, really is looking at these medications and saying, okay, there really is 1 milligram of melatonin in this capsule. With herbal supplements, that's not regulated. So these independent companies go on their own and basically say, this supplement says that there's this in there. Therefore, we've tested it and it is true or it's not true. This company is more credible than another. So keep that in mind. And then lastly, each of the providers that are here today, including myself, the National Comprehensive Cancer Network, or the NCCN, pretty much governs our decisions and our processes on how we decide what cancer therapies to use or what supportive care agents we need to add along with therapy based off side effects. There's also a section in that network. It is free to enroll. There's patient support information to manage these long-term toxicities like sleep and anxiety and stress. So that's also something that you can reach out to. And remember, we're here for you. Pharmacists, whether at a drugstore or in clinic, there's wealth of knowledge behind our training, and we're happy to help, manage anything that you need, because our goal is to make sure you have a good quality of life. So please, if you ever see me around the Cancer Center, please feel free to reach out to me.
Thank you so much. That was so informative and just wonderful, wonderful information from each one of you. We do have a few questions. So let me start with that. Cam, you mentioned that like acupuncture, yoga, massage are not covered by insurance, but do you know if you can use your flexible spending account dollars to pay for those? I think you're muted. There you go.
That's a good question. I don't think that you can use FSA dollars, but that would be a better question for your insurance company.
Okay. All right. Great.
I do have a little bit of insight on that. If you have a health savings account or a flex spending account, if you receive therapy that is billed through your insurance and they do not cover it, there are some services like therapy type sessions that they will let you use your HSA or FSA account.
Okay, great. Also for Cam, if you're looking to get acupuncture, what type of credentials do you need to look for so that you're sure that you're going to someone who's accredited?
There is a national organization that certifies licensed acupuncturists. I think it's the ACCOM, and most licensed acupuncturists will provide that information. I think it's important to look for someone who has been practicing for several years and has a lot of experience, and preferably has experience with an oncology population. Not every licensed acupuncturist is familiar with cancer patients and the unique health questions regarding cancer.
Okay, great. One of the things that Jonathan talked about, I just want to put a little bit of a plug in for cancer services, is he talked about that period after your active treatment and how it can be very stressful as you move into your recovery period where you're not going to the doctor every week. You're not as connected with your medical team as you were when you were in active treatment. Cancer Services does offer a program called Cancer Services Transitions Wellness Program, and we offer it usually about 4 times a year. So you can always keep an eye on our program calendar to see when the next class is coming up. We do have our next class coming up in August. It meets for 4 weeks, 1 night a week, and currently we are doing that online. So doesn't matter where you live, you can still participate in it, but keep an eye out for that. I believe Julie just put the link for more information or to register in the chat box. So that is a good program that really can help you during that transition period. Let's see what other questions we have. What can you do, or how can you try to break the vicious cycle of stress and can't sleep? So you can't go to sleep, and then that causes you to have stress. So you lay there having stress about not being able to sleep, and then you know you need to sleep. And so how can you try to kind of break that cycle?
I guess I can start with that one, and maybe that's sort of what I was talking about, which is really only going into the bedroom when you're ready to sleep. And if you're not sleeping successfully, getting up out of bed and going into the living room or another room and doing something else until you start to feel drowsy again. So lying there, looking at the ceiling or looking at the clock, watching the time click, thinking, you know, I have to get up in 4 hours. I have to get up in 3 hours. I'm going to be so tired. That's not constructive. So physically changing your location, going in another room, reading a book, listening to music, trying to find something to calm your mind. Maybe that's that belly breathing, something kind of monotonous enough so that it's not waking you up, but getting you feeling kind of lazy and drowsy again. and then trying again to go into sleep.
Okay, great. One more question for you, Cam. Hold on a minute. I just lost my train of thought. Okay. Can someone with lymphedema do acupuncture or have acupuncture?
Yes, I think so. There are numerous acupuncture points around the body. So the acupuncture therapist or acupuncturist may not put needles into your affected limb, for example, but they still might utilize some other acupressure points. And the other thing to think about with acupuncture is the needles are very, very fine. They're finer than a human hair. They're really tiny. They don't go deep. They just barely penetrate the top layer of the skin. So we don't think that it's a problem with lymphedema.
Okay, great. Another question is, how do I find a CBTI therapist and get an appointment?
There are some resources online. For example, I think the journal Psychology Today offers a listing of psychotherapists and counselors that you can search by zip code or by town, and they list particular types of therapies, including CBT, for example, or CBTI. Katie, do you have any other thoughts on that?
I do not. I know there are resources out there, but I'm unfamiliar right now with what those are.
You do have someone, though, in the integrative clinic that is certified and trained in that?
Not with CBTI.
Not specific. Okay.
We would have to refer you out to someone.
Okay.
I second what Cam said. I think the APA or the American Psychological Association's website would be a good place to start. I think that would be an excellent place, and they do have a provider directory.
All right, great. What was that link again, Jonathan?
The American Psychological Association.
Do you know if that's a .org?
I believe it is.
Okay. Okay, are there any other questions? Feel free to put them in the chat box or the Q&A box, and we can get those answered.
As far as CBTI, you can also go to psychologytoday.com, and they also have an option for finding a therapist.
Okay, great. And we do have someone that is interested in getting teamed up with a therapist to help with stress. So that could be done could start with your department, at least the integrative medicine department, or through the counselor at the cancer center. And then if a specialized type of therapy was needed, you could refer them out to that.
Exactly.
Okay, great. This has been wonderful, so informative. I think the biggest thing to do after you have one of these presentations like that is to take what you learn and what you hear and put it in action. You don't have to take everything and try to put it to work because that would be overwhelming and probably cause stress and anxiety. But if you just take one or two, especially some of the sleep hygiene steps, if you just try to take one or two of those at a time and see what works for you and try one for a little bit, and then if that's not working, move on to another one. But you'll never know unless you try. And as Cam mentioned, a number of these hygiene practices have been studied to be effective. So it's not like she's just coming up with these and throwing them out there as, hey, try this. They're all proven and shown to be effective. So we want to follow the science and try those things. We will have this video on our YouTube channel, so you can review it again if there's anything that you want to kind of hear again or see again. We'd love to hear from you. If you try any of these practices or anything that you've learned that was new to you today, we would love to hear from you. You can email us your comments. Also, at the end of Survivor Week, we will send out an evaluation, which is really important for us to get your feedback on your thoughts for the week. But I really do want to thank you all for participating today. And another thanks to this wonderful panel who has helped us with the lions, tigers, and bears. And we look forward to tomorrow's session, which is Gentle Chair Yoga with Angela Gallagher. Cam mentioned this in her presentation. Angela is a certified yoga instructor, and she also works in the integrative oncology medicine practice at Novant. But she will be with us tomorrow from 3:30 to 4:30, and we are going to focus on relaxation, stress reduction, and breathing techniques. So hope I'll see you there tomorrow. And also don't forget to submit your pictures and your photographs so we can have those for our slideshow on Saturday. Thanks again for being with us for today, our first day of Survivors Week. You'll use the same link to each of our presentations, the one that you used today. We will be sending out daily emails with information about the following day. And we hope that you all have a wonderful day and a wonderful week. And thank you for joining us.
Thank you.